I know the FDA is expected to follow the panel's recommendation. They're going to approve, likely, this vaccine. Does Children's know how many doses they'll get, and what's the plan for vaccinating staff?
Yeah, so the final distribution plan will be determined by the state. And the sense is, though, that based on what is known about the recommendations for how this vaccine be allocated and what is expected to be available in terms of number of doses that would be allocated to Massachusetts, Boston Children's has a fairly good sense of how many doses that they would receive. And as soon as the EUA is announced and all of the operational features are in place to start vaccinating staff, Boston Children's plans to start vaccinating staff.
Okay.
And the operations have already been in the works for a while.
Got it. All right, so we know kids typically experience mild symptoms, but you probably still have patients with compromised immune systems, other risk factors. How long do you think you'll have to wait before there's a vaccine approved for them?
Yeah, so the goal would be that we have solid enough safety and immune response and efficacy data in trials of these vaccines in children to be able to offer a COVID-19 vaccine to all children. Pfizer, as we've discussed here before, began immunizing adolescents aged 12 to 15 years of age back in October. Moderna actually just announced that they began immunizing adolescents yesterday. Pfizer announced today that they hope to move the vaccine into 5 to 11-year-olds in April of 2021 if the vaccine in adolescents shows good safety and immune data. And Moderna will likely follow suit and have also announced that they hope that they have solid enough data from their adolescent studies to be able to offer this vaccine to adolescents by the start of the school year in fall 2021. So there's progress there. It's just still a long way to go.
What about pregnant women? We know COVID-19 can increase their risk for severe symptoms, even premature deliveries. So what about the vaccine? Should they get it? Do we know yet how it could affect their baby?
Yeah, no, it's a great question. And the short answer is no. We don't know anything about this vaccine in pregnant women because pregnant women were specifically not included and were actually excluded from any of the phase 3 trials so far. So there is a sense, though, that it would be critically important for pregnant women, particularly those who are prioritized to receive the vaccine because they are perhaps a frontline, a first responder, a healthcare worker who takes care of patients with COVID-19, to be able to receive this vaccine just as their non-pregnant peers would be able to. And so the expectation is we are awaiting final word on this from the Advisory Committee on Immunization Practices, but the expectation is that those recommendations for any of these EUA vaccines to be made available to pregnant women who would otherwise be prioritized to receive the vaccine, as long as that individual is able to have a discussion about whether the benefits of the vaccine outweigh the risks with their own provider too.
Well, a lot of steps forward here, and we're just learning that panel did just vote to approve the Pfizer vaccine 17-4. So some good news to report today. Dr. Moffitt, thank you so much for your time. Really appreciate it.
Yeah, thanks for having me.